You wouldn't drive a classic car for decades without regular maintenance, would you? You check the oil, rotate the tires, keep the engine tuned because you understand that neglect leads to breakdown. And yet, many men over 60, despite caring deeply about their health, are left guessing when it comes to a vital part of wellness that rarely gets discussed: masturbation. If you're older and masturbate, or if you're wondering whether masturbation is good or bad for health, you're not alone. This topic is filled with myths, shame, and a troubling lack of trustworthy information, especially when it comes to prostate health, erectile dysfunction, and healthy aging. That's why I want to welcome you to this important conversation. I'm Dr. Lauren, a senior wellness educator with over 20 years of experience supporting elderly men and women through the complex, beautiful, and often misunderstood journey of aging. My work has focused on bridging the gap between modern urology, sexual health, and what I like to call senior wisdom, the kind of life experience that deserves answers grounded in science and compassion. So whether you're 50, 60, 70, or beyond, whether you've wondered is it healthy for older men to masturbate, or felt unsure about the side effects of masturbation after 60, this video is for you. We'll explore what current research really says about healthy masturbation habits, the surprising ways it may support your prostate health and emotional well-being, and yes, some risks to be aware of. This is not a lecture. It's an honest, science-based look at an everyday act that millions engage in, but few talk about openly, especially in the world of men's health. If you're someone who's ever silently wondered things like, would you ever watch a guy masturbate? Would it be hot to watch him masturbate in front of you? Don't worry. We'll even talk about how those intimacy questions fit into the bigger picture of senior wellness and self-respect. So let's begin with clarity, kindness, and the confidence that comes from understanding your body better. Because if you're older and you masturbate, it's time to finally get the answers you deserve. Today we are tackling one of the most common yet unspoken concerns in men's health: masturbation after 60. This isn't just about sexual satisfaction, it is about senior wellness, prostate health, and healthy aging. Yet this topic remains shrouded in masturbation myths, outdated cultural taboos, and a surprising lack of clear, science-based information. Here's what might surprise you. According to recent studies in urology and men's health, a significant percentage of men over 50 continue to masturbate regularly. Yet many do so with lingering questions, doubts, and concerns that they've carried for decades. Some wonder if they're causing harm, others worry about frequency, and many simply want to know, is masturbation good or bad for health as we age? The truth is, sexual health doesn't have an expiration date. Whether you're 50, 60, 70, or beyond, understanding healthy masturbation habits is part of comprehensive senior health. Your sexuality is a legitimate part of your overall wellness, and you deserve accurate, respectful information to make informed decisions about your body and your life. Understanding senior sexual health, the complete picture. First, let's address the elephant in the room with some context. Many men over 60 grew up in an era when masturbation was considered everything from morally questionable to physically harmful. You might have heard warnings about blindness, weakness, or mental health issues, all of which have been thoroughly debunked by modern science. The reality is far more nuanced. For older men and masturbation, the research suggests that moderate, healthy sexual activity, including self-pleasure, can actually be beneficial for several aspects of men's health. But like any health practice, context matters. The key questions aren't just is it good or bad, but rather how does it fit into your overall wellness strategy? Let's think about this like we would any other aspect of healthy aging. Just as we've learned that moderate exercise is beneficial but overexertion can be harmful, sexual activity follows similar principles. The goal isn't to maximize frequency but to maintain healthy patterns that support your overall senior wellness. The health benefits, what research actually shows. Let's examine what peer-reviewed research in urology and men's health actually tells us about masturbation after 60 to 1. Prostate health support. This is perhaps the most significant finding. A landmark study published in the Journal of the American Medical Association followed nearly 30,000 men for 8 years. The research suggested that men who ejaculated 21 or more times per month had a 31% lower risk of prostate cancer compared to those who ejaculated 4 to 7 times per month. Now, this doesn't mean masturbation prevents prostate cancer. Correlation isn't causation, but the theory is compelling. Regular ejaculation may help flush potentially harmful substances from the prostate ducts, similar to how regular exercise helps maintain cardiovascular health. This prostate health advice has led many urologists to view moderate sexual activity as potentially beneficial for older men. 2. Maintaining erectile function. Here's where our car maintenance analogy becomes particularly relevant. The penis, like any organ, benefits from regular blood flow. During an erection, blood fills the spongy tissues called the corpora cavernosa. This process helps maintain tissue elasticity and health. For men over 50 dealing with age-related changes or early signs of erectile dysfunction, gentle, regular sexual activity can be part of maintaining function. It's not a cure for ED caused by medical conditions, but it can help prevent the use it or lose it scenario that some men face. 3. Cardiovascular benefits. Sexual activity, including masturbation, can provide mild cardiovascular exercise. The heart rate increases, blood pressure rises temporarily, and then both return to baseline, similar to moderate physical activity. For seniors who may have limited mobility or exercise options, this can be a small but meaningful contribution to cardiovascular health. 4. Stress management and sleep quality. The hormonal cascade that occurs during orgasm is fascinating from a health perspective. Your body releases oxytocin, often called the bonding hormone, endorphins, natural painkillers, and prolactin, which promotes relaxation. Simultaneously, cortisol levels drop significantly. For older men dealing with chronic stress, sleep difficulties, or mild depression, all common challenges in senior health, this natural biochemical response can be genuinely therapeutic. Many men report better sleep quality after sexual activity, which is crucial since sleep often becomes more challenging with age. 5. Pelvic floor strength. The rhythmic contractions during orgasm engage the pelvic floor muscles, particularly the pubococcygeus muscle. A strong pelvic floor is essential for urinary control, erectile function, and overall pelvic health. As men age, these muscles naturally weaken, potentially leading to urinary incontinence or reduced sexual function. Think of masturbation as a form of pelvic floor exercise, not as intensive as dedicated Kegel exercises, but still beneficial for maintaining muscle tone and function. 6. Mental health and cognitive benefits. Sexual activity stimulates the release of dopamine, the neurotransmitter associated with pleasure and motivation. For elderly men who may be dealing with retirement transitions, loss of spouse, or other life changes, maintaining this natural mood-boosting mechanism can be valuable for mental health. Additionally, the fantasy and anticipation involved in sexual activity keeps certain neural pathways active, potentially contributing to cognitive health as part of an overall use it or lose it approach to brain health. Potential concerns and masturbation side effects. What you need to know. Now, let's discuss the other side of the equation. Like any health practice, there are considerations and potential masturbation side effects that older men should be aware of. 1. The moderation question. How often should you masturbate? This is perhaps the most common question, and unfortunately, there is no universal answer. What we do know is that extremes in either direction can be problematic. Complete abstinence may increase the risk of prostate issues and can lead to nocturnal emissions or discomfort. On the other hand, excessive frequency, particularly multiple times daily over extended periods, can lead to physical irritation, fatigue, or what some men describe as pelvic congestion. Most urologists suggest that what feels natural and comfortable for you is likely appropriate. If you're masturbating daily and feeling good physically and emotionally, that's likely fine. If you're going weeks without any sexual activity and feeling comfortable, that's also likely fine. The key is listening to your body and avoiding extremes driven by compulsion rather than desire. 2. Physical considerations for aging bodies. As we age, our skin becomes thinner and less elastic. This means the genital skin can be more susceptible to irritation or micro tears if masturbation is performed too vigorously or without adequate lubrication. These tiny injuries can become gateways for infection or chronic irritation. The solution is straightforward. Always use a quality, body-safe lubricant and maintain gentle pressure. Think of it as treating your body with the same care you'd give to any valuable aging equipment. 3. Desensitization and technique dependency. If you've been masturbating the same way for decades, same pressure, same rhythm, same technique, your nervous system can become conditioned to respond only to that specific stimulation. This can create challenges with partnered sex or even solo experiences that deviate from your established pattern. For men over 60 who may be entering new relationships or trying to maintain intimacy with a long-term partner, this can be particularly relevant. The solution is to occasionally vary your technique, pressure, and rhythm to maintain sensitivity and adaptability. 4. Masking underlying health issues. This is a crucial point that many men overlook. If you can achieve erections and orgasms during masturbation but struggle with erectile dysfunction during partnered sex, it might be tempting to assume the problem is purely psychological or relationship-based. However, this pattern can sometimes mask serious underlying health conditions. Cardiovascular disease, diabetes, hormonal imbalances, or neurological issues can all manifest as erectile dysfunction. The different pressure, stimulation, and psychological factors involved in masturbation versus partnered sex can temporarily compensate for these underlying issues. If you notice significant differences in your sexual function between solo and partnered activities, it is important to discuss this with a healthcare provider rather than simply relying on masturbation as a workaround. 5. Postural and physical strain. Many men develop masturbation habits that involve poor posture, hunching over, sitting in uncomfortable positions, or putting pressure on the perineum, the area between the genitals and anus. Over time, this can lead to nerve compression, particularly of the pudendal nerve, which can cause numbness, tingling, or pain in the genital area. The ideal approach is to practice in comfortable, relaxed positions that don't put undue pressure on your body. Lying down with proper support is often better than sitting in a hard chair or awkward position. 6. Emotional and psychological considerations. For some men, masturbation can become an unhealthy coping mechanism for stress, loneliness, or boredom. While occasional use for stress relief is normal and healthy, relying on it as your primary or only emotional regulation tool can be problematic. Additionally, many men over 60 carry decades of guilt or shame about masturbation, often rooted in religious or cultural upbringing. These feelings can create internal conflict and stress that actually undermines the potential health benefits. If you find yourself using masturbation compulsively to avoid dealing with emotions, or if you experience significant guilt or shame that causes distress, it may be helpful to speak with a counselor or a therapist who specializes in sexual health. 7. Impact on relationships and intimacy. Sexual energy and interest are infinite resources. If masturbation becomes a substitute for intimacy with a partner rather than a complement to it, it can impact relationship dynamics. This is particularly relevant for older men who may already be dealing with age-related changes in libido or sexual function. The healthiest approach is to view masturbation as part of a broader sexual wellness strategy that includes, rather than replaces, intimacy with your partner when applicable. 8. Pornography and unrealistic expectations. While not directly related to masturbation itself, Many men combine self-pleasure with pornography consumption. For older men, particularly those who may have started consuming pornography later in life or have increased consumption during retirement, this can create unrealistic expectations about sexual performance or appearance. Modern pornography often depicts sexual scenarios that are unrealistic for most people, particularly older adults. If masturbation becomes heavily dependent on extreme or unrealistic pornographic content, it can make real-life sexual encounters feel inadequate or disappointing. Practical advice for the elderly. Senior wisdom meets modern science. Now that we've covered the research and potential concerns, let's talk about practical, actionable advice for elderly men who want to maintain healthy sexual practices. Creating healthy masturbation habits. Timing and frequency. Listen to your body's natural rhythms. Many men find that sexual desire fluctuates with stress levels, health status, and life circumstances. Rather than following a rigid schedule, pay attention to when you feel genuine desire versus when you might be acting out of habit or boredom. Physical preparation. Treat this as you would any other self-care activity. Ensure you're clean, comfortable, and have adequate privacy. Keep quality lubricant readily available. This isn't optional as you age. Consider it as essential as having reading glasses or any other tool that makes life more comfortable. Environmental considerations. Create a comfortable environment. Good lighting can help you monitor your body for any changes or issues. Comfortable temperature and a relaxed setting contribute to a positive experience and reduce the likelihood of rushed or uncomfortable practices. Health monitoring and awareness. Regular self-examination. Sexual activity provides an opportunity for routine self-examination. Pay attention to any changes in sensation, appearance, or function. Look for unusual lumps, changes in skin texture, or areas of persistent irritation. Tracking changes. Keep mental notes of any changes in your sexual response, erectile function, or overall comfort. These observations can be valuable information to share with your healthcare provider during regular checkups. When to consult a doctor. Seek medical advice if you experience persistent pain, significant changes in erectile function, changes in ejaculation such as blood and semen, or any unusual physical symptoms. Don't let embarrassment prevent you from addressing legitimate health concerns. Integrating with overall senior wellness. Holistic health approach. Consider sexual health as part of your broader wellness strategy. Regular exercise, good nutrition, adequate sleep, and stress management all contribute to sexual health. Conversely, maintaining sexual activity can contribute to overall physical and mental well-being. Medication considerations. Many medications commonly prescribed to older adults can affect sexual function. Blood pressure medications, antidepressants, and prostate medications can all impact libido, erectile function, or sensation. Discuss these effects with your doctor. There may be alternative medications or timing strategies that can help. Cardiovascular health connection. Remember that erectile function is often an early indicator of cardiovascular health. The blood vessels in the penis are smaller than those in the heart, so circulation problems often show up there first. Maintaining good cardiovascular health through diet, exercise, and medical management supports sexual function. Addressing common concerns. Performance anxiety. Many men over 60 experience performance anxiety, whether during masturbation or partnered sex. This can create a cycle where anxiety impacts performance, which increases anxiety. The key is to focus on pleasure and comfort rather than performance metrics. Changing body image. Aging bodies look and feel different. Rather than focusing on what has changed, try to appreciate your body for what it can still do and feel. This shift in perspective can significantly improve your sexual experience. Partner considerations. If you have a partner, open communication about sexual needs and preferences becomes increasingly important with age. Masturbation can be a healthy part of a relationship, particularly when partners have different libidos or health limitations. Advice for specific situations. For widowed men, if you've lost a spouse, maintaining sexual activity through masturbation can be a healthy way to preserve this aspect of your wellness while you grieve and potentially consider new relationships. For men with chronic health conditions, diabetes, heart disease, arthritis, and other chronic conditions don't necessarily preclude sexual activity. Work with your healthcare team to understand how your conditions and medications might affect sexual function and develop strategies that work within your health limitations. For men taking multiple medications, if you're taking several medications, their combined effects on sexual function can be complex. Don't assume that decreased sexual function is just part of aging. It may be a manageable side effect of your medication regimen. Building long-term sexual health. Maintaining flexibility. As your body changes, be willing to adapt your sexual practices. What worked at 40 may not work at 70, and that's okay. Flexibility and openness to change are key components of healthy aging. Staying informed. Sexual health research is continuously evolving. Stay informed about new developments in men's health, but be cautious about fad treatments or miracle cures. Stick to evidence-based approaches and consult with healthcare providers about new treatments. Community and support. Consider joining senior wellness groups or men's health support groups where these topics can be discussed openly. Many men find it helpful to know they're not alone in their concerns and experiences. Conclusion: your sexual health is part of your overall wellness. Let's bring this all together with some final thoughts rooted in both science and senior wisdom. If you're older and masturbate, you're engaging in a normal human behavior that, when practiced thoughtfully and moderately, can be a valuable component of your overall health strategy. Just as you have learned to adapt other aspects of your self-care routine as you have aged, perhaps taking joint supplements, adjusting your exercise routine, or being more mindful of your diet, sexual health deserves the same thoughtful, informed approach. The key insights we've covered today: health benefits are real. The research supporting the potential benefits of moderate sexual activity for prostate health, cardiovascular function, stress management, and overall wellness is substantial and growing. These aren't just theoretical benefits, they're measurable impacts on your physical and mental health. Moderation and mindfulness matter. Like any health practice, the devil is in the details. How you approach masturbation, the frequency, technique, emotional context, and integration with your broader health strategy makes the difference between a beneficial practice and a potentially problematic one. Individual variation is normal. What works for one man may not work for another. Your health status, medication regimen, relationship situation, and personal preferences all influence what's optimal for you. There's no one-size-fits-all answer to questions about frequency or technique. Professional guidance is valuable. Sexual health is a legitimate medical concern that deserves professional attention. Don't let embarrassment or outdated cultural attitudes prevent you from discussing these topics with your healthcare provider. A good doctor will treat your sexual health concerns with the same professionalism they bring to any other aspect of your wellness. Change is normal. As you age, your sexual response, desires, and needs will naturally evolve. This isn't a failure or a problem to solve. It is a normal part of the aging process that requires adaptation and acceptance. Quality of life matters. Sexual health isn't just about function, it is about maintaining an important aspect of your humanity and personal satisfaction. You deserve to feel good in your body and to experience pleasure throughout your life. The bottom line: your sexual wellness is a legitimate part of your overall health, and you deserve accurate, respectful information to make informed decisions about your body and your life. Whether you're 50, 60, 70, or beyond, maintaining this aspect of your health can contribute to your overall quality of life and well-being. Remember, senior wisdom includes knowing when to seek professional guidance and when to trust your own body's signals. If you have concerns about your sexual health, erectile dysfunction, prostate health, or any changes in your sexual function, don't hesitate to consult with a healthcare provider who specializes in men's health or urology. Most importantly, don't let shame, embarrassment, or outdated myths prevent you from taking care of this important aspect of your health. You've earned the right to comprehensive, compassionate healthcare that addresses all aspects of your well-being. Your body has served you well for decades. It deserves informed, respectful care in all areas, including sexual health. By approaching this topic with the same wisdom and thoughtfulness you bring to other aspects of your health, you're taking an important step in maintaining your overall wellness and quality of life. If this information has been helpful, I encourage you to share it with other men who might benefit from this conversation. Sexual health education for older adults is often overlooked, but it's a crucial component of healthy aging that deserves more open, honest discussion. Take care of yourself, and remember your health and happiness matter at every age. Final note: if you found this information valuable, please consider sharing it with others who might benefit. These conversations are important, and the more we normalize discussions about sexual health and healthy aging, the better equipped we all are to make informed decisions about our wellness. Thank you for taking the time to educate yourself about this important aspect of your health.